All right, we are live here at Warrior Medical Group in Annapolis, Maryland with Dr. Patel and Datina. And Datina is here with our podiatrist, Dr. Patel. And I'm going to let you take the lead on what you're finding out here about Datina's toe and foot and whatever's going on there.
Yeah, so great thing about Warrior Medical is you can get tailored service for you in your schedule, because now we added our podiatry services. I could come to the house, you could come here, we can discuss things as in much time length as you need rather than being rushed in 10-15 minute appointments somewhere else. Today we're talking about her bunion is her most concern, and some pain on the bottom of her foot. So basically we're going through her life story and how she uses her foot and how we can improve it. So the main thing we were talking about is she's getting a little bit less fat pad in her foot, pushing the fat pad in front, uncovering the knuckles of her foot, leading to more pressure, more pinpoint pain, kind of like feeling like she has a rolled up sock or a marble stuck in her shoe. We were discussing adding padding to the shoe so that you can actually walk more functionally. Even talking about dermal filler injections that we can put in the foot. Those last up to 6 months, but you need to repeat the process. But it's not a permanent thing. Because then we talked about surgery to fix her bunion. So tell me a bit more how your bunion's affecting your everyday life.
I'm very limited in the shoes that I can wear. And I'm very limited in the shoes, whether or not they're high or not. I'm a small lady, I need a little height, and I can't wear shoes that are very high.
Right.
So, and then of course, I bring extra shoes with me in the car at all times, which is a real pain.
Yeah.
Because if my feet start hurting, I may have to go to the car and switch out.
Yeah.
So I can get through the rest of the day.
I might try to do that too. If I change my outfit, get some black shoes, get some white shoes. But
I do it for pain, really.
Yeah.
I don't have to change that much, but I like to always be prepared.
Right, good. So you could get away with the bunion pain by reducing the pressure it takes on the bunion. So the narrow, I call it church shoes, they're not really good for bunion situation. There's no sugarcoating it. You can't jam a square peg in a round hole sometimes. So it's the softer shoes on top, the sturdy soles, the rounded toe box, which can be best for bunions. But then we're getting into the grandma shoe territory. We don't really want to pigeonhole.
I'm a grandma, but I don't want to look like one.
So it's the softness of the top and the firmness of the bottom. It's a good compromise. But you got to get some roundness of the toe box. Now with her bunion, it's a little bit of arthritis is setting in because of the malalignment of the bunions. It's not really a growth of the bunion. It's more the bone has swung out and the toe has swung in, causing that bump, and that's what's rubbing on the shoe. And then the malalignment of the joint is kind of grinding into her joint. We talked about surgery to fix it. In the past, you have big incisions that go in there in the joint and cut the bone, move the joint across, and sew everything back up. Nowadays, we could do it minimally invasive with 3 poke holes and 3 stitches. Basically, we cut the bone, shift it across, rotate the joint back where it should be, hold that shift with 1 or 2 screws, and maybe lengthen a ligament or a tendon down here, and the toe can sit straighter. With that type of surgery, you can walk out of surgery with a surgical shoe or a boot. Usually you're wearing that for 6 weeks, because no matter what you do or what surgeon it is, it takes 6 weeks for bone to heal. On that note, we were talking about just general nutrition too, about how you do some energy evaluations and vitamin D levels, and that we want to make sure the patient is ready to accept surgery and recover afterwards. So now we talk about vitamin D. Vitamin D will help as the building blocks to create new bone and keep the bone you have. And for supplementation wise, if you get a vitamin D level, the lab wants you to be between 20 and 30. I like to, for patients who are having surgery, be 40 and above so you can recover your healing bone.